सो देखने वालों को हमारा सलाम, मैं नासिर हूँ और आज का ये हमारा ये हेल्थ पॉडकास्ट जो है ना, ये बड़ा स्पेशल होने वाला है क्योंकि वन ऑफ माय फेवरेट डॉक्टर्स। और जब भी इनसे हम ये गुजारिश करते हैं कि प्लीज़ कुछ लम्हे हमारे साथ बिताइए, ये कुछ सोचते नहीं और हाँ बोल देते हैं। हमारे साथ आज डॉक्टर सुशील राजदान है, किसी तारुफ के मोहताज नहीं, लेकिन फिर भी आपको बता दूं कि वर्ल्ड फेमस न्यूरोलॉजिस्ट हैं। बहुत बहुत शुक्रिया डॉक्टर साहब।
Thank you,
इट्स
thank you,
ऑलवेज
man.
लवली टॉकिंग टू यू।
Me too. I love
मैं
to talk to you always.
आज का ये इंटरव्यू जो है ना, ऑफ कोर्स हम बात तो करेंगे ही कि आप कितने पेशेंट्स देख रहे हैं, किस तरीके से लोगों को अपना ख्याल रखना चाहिए, बट आई वांटेड टू बी अ वेरी इनफॉर्मल थिंग। पीपल नो यू एज डॉक्टर सुशील राजदान, राइट? बट हु इज सुशील राजदान? Not the doctor, but who is Sushil Razdan? We want to know about it. Because whenever I have called you, जब भी हमारी बात हुई है या मुझे फ़ोन आते हैं, कहते हैं कि we want that डॉक्टर सुशील राजदान हमारे पेशेंट को देखें, आप अपने लिए वक्त निकाल पाते हैं?
यही मेरा ही वक्त है।
अच्छा,
जो हम
that's a
देखिए
wonderful answer.
इनफैक्ट पहले पहले थोड़ा दिक्कत आती थी, वो ये अब ये वे ऑफ लाइफ हुआ है।
जी।
सीइंग पेशेंट्स हैज बिकम वे ऑफ लाइफ एंड वेरी मीनिंगफुल। इसी अल्टीमेटली इट्स नॉट कि मैं कितना ट्रीट कर रहा हूँ, कितने ठीक होते हैं। द स्टोरीज आर एनग्रॉसिंग,
Yes.
अमेजिंग स्टोरीज। हर एक पेशेंट जो थोड़ी सी भी तकलीफ हो या बड़ी भी तकलीफ हो, इफ यू सी तकलीफ तो रखिए मेडिकल्स, द कंटेक्स्ट उनका, द फैमिली उनकी क्या काम करते हैं, कैसे उनका सोशल सेटअप है, हाउ
बिल्कुल।
इट हैज गॉट अफेक्टेड और हाउ इट दिस इज वेरी आई डोंट थिंक देयर इज एनी अदर स्टोरी मोर ब्यूटीफुल और मोर एनग्रॉसिंग और मोर मीनिंगफुल देन अ पेशेंट स्टोरी।
मुझे डॉक्टर साहब, मेरा ये पर्सनल एक्सपीरियंस आपके साथ ये रहा है कि मुझे लगता है कि जिस भी पेशेंट को आप देखते हैं ना, आप सिर्फ उस पेशेंट को नहीं जानते, उसकी पूरी फैमिली हिस्ट्री आपको पता होती है।
बिल्कुल 3 जनरेशन से आई थिंक आई हैव बीन वर्किंग फ्रॉम से 81 से मैं न्यूरोलॉजिस्ट हूँ।
जी।
बिफोर दैट आई वाज आल्सो सीइंग पेशेंट। इनफैक्ट 75 से ही पेशेंट है। मोर देन 50 इयर्स आई हैव बीन सीइंग पेशेंट्स। और अभी भी वो दे आर हमें उनके साथ काफ़ी काफ़ी मन है, उनको जानते हैं 3 जनरेशन से।
सो कभी ऐसा हुआ आपके पास ग्रैंड एपे पेरेंट्स भी बच्चों के आए हैं,
बिल्कुल
दादे
बिल्कुल
भी आए हैं,
बिल्कुल
फिर उनके
बिल्कुल।
बच्चे आए हैं, फिर उनके बच्चे आए हैं।
दादी लड़का उनके बच्चे। इट्स वेरी अमेजिंग स्टोरी। यू नेवर
So your treatment runs through generations, right?
generations. जनरेशंस। मैं हमें कहते जो सोचता ही उस मेरे दादा को या नाना को देखा, ही इज नो मोर नाउ देन ही टोल्ड। उनकी पर्चियां दिखाते हैं मेरे को, वो पे लैमिनेटेड पर्चियां दिखाते हैं, विच आर 40 30 25 इयर्स ओल्ड। पर
मतलब डॉक्टर साहब, मैं वो चीज़ जानूँ तो हिंदी टोटल जी तुम जो सॉरी एक्सपीरियंस अगर तो ऐसे वनुन अगर हो सकता है कि मे बी आप एक किताब लिखें, तथ मज ऐसे सॉरी एक्सपीरियंस था वो, तो क्या लिखेंगे आप उसमें? कभी
how
सोचा है?
I was a very I'm still I'm very ordinary, and how beautiful it has been to be with people all around, all over the see maximum तो मेरा कश्मीर से भी वाबस्तगी रही है, जम्मू कश्मीर से, लद्दाख से, देर ऐसी। बट इट हैज़ बीन इवन दिल्ली, मुंबई, वेयर आई समटाइम्स सी पेशेंट। दिल्ली तो मैं रेगुलरली जाता ही रहता हूँ। इट हैज़ बीन वेरी 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 वेरी
An
I
enriching
still work. I
experience.
still work at this
Absolutely.
age.
You
That is the
आप इंस्पिरेशन हैं, आप अभी भी काम कर रहे हैं। तोय वनो कि 35 वरी वोत तोय तुय छु पेशेंट्स वुछान। मैं वनतो अख कथ कि यम पेशेंट्स तोय निश आजकल छ यिवान, या यम पेशेंट तोय निश 20 वरी या 30 वरी ब्रोंट ٲسۍ यिवान, तोय छा बासान कि द डिजीज पैटर्न हैज चेंज्ड?
oh yes, very important. Disease pattern को वारिया change, going to the technical part of it, we see more of psychological disturbances with somatization. ये मन्ना not psycho, थमन छ आसान कल दर्द, neck pains, backache, problems with day-to-day living, anxieties. They have definitely increased. We wouldn't see so many of them previously. वाकई epilepsy छ तथे कहीं stroke छ वारिया, dementias बड़ी वारिया. The dementias in populations have increased because of large number of elderly people we have got now, demographic changes, and drug issues. the problems due to drug side effects affecting nervous system bade, like drug abuse or side effects of so many drugs. And I think Baki would see patients may tell it differently, but patients' narrative shouldn't change.
Same
Say
asa.
the way his
More or less
emotions are
same.
more or less same. I don't think narrative anywhere in the world. Patients' narrative sorry huey asa. Tawai should them doctor sun zorat pewana theke so Google petay varia kerit alaj bapan.
Acha, yus aise age group os patientن hund az bront 30 ؤری تہٕ az tat mutalik tuhund kya chu vanun?
As your patient group should but informative. They know, they have a lot of information, they have a lot of knowledge. They want more from doctors now. Tele ke hum as patient so सवाल ही प्रसा.
अच्छा सोच यमा डॉक्टर साहबस निश मे दोद करान कलस
He would
ये वन्या डॉक्टर साहब ती
he should
ओस
we thought he is the final authority, but due to information revolution and access easy by just by touching you get about in fact I should patient my one me go ye side effects to he one we nie guys asan should posi pats. See, you cannot remember everything, you cannot know everything, but patient should para supiut bada asal poet, bada asal deep gasa. The way we tell him, it may not be all the time. He is not happy with it. He is more he wants more now. He is not.
So toicha basan ki with the advance in information technology doctor sab ekis doctors chumai pan te varia informative asan rozun.
But it's so rich. See, skills will be very important.
Doctory rules no mein ki medical schools mas kya ho
No. Update.
So it is constantly changing, right?
Bilkul Nasir bhai, skills, information, and it is moving at a very rapid pace with AI coming, new drugs, and this has not been taught in medical school. Not even you have to relearn everything.
Okay.
Imagine, for example, the most simple cheez, ye pass ko MRI osse ne kunjai, CT chasna kathi. We had to all reread, go for updates. Then only we could. Second cheez asti ma, naiv dawa shi ma har kunj see. Give simple examples. Alzheimer's osse treatment take. Bill 6 months draw dawa lecanemab. Everybody has to, all neurologists have to read about it because Buhiris Shairit Ertrit Pay you dun. How to give it, how to select the patient, and you just cannot tell patient I brought pata ye dawa drao. Tum brought hi vata information through his sources or through net, and we have to be 10 times ahead of him.
Bemar che science society mus doctor sab is imo age group hisab. Let's talk about dementia first. Trigger factors kya chu dementia?
Which trigger chu at age. As you grow old, it affects nam to patients and person. There are 60, 70, 80% chances of his be having dementia also.
Okay.
Go age should side khud risk factor. Number 2 should midlife hypertension and diabetes.
Okay.
3 should genetic predisposition. Tsurim che bana agar depression gets late life mas it should risk factor bana.
Acha.
Beishu varia dementia mas gasan deficiencies in elderly for being alone.
Okay.
If
The
they are
emptiness
alone,
syndrome yat
yeah, alone asan kennas mas bada gasa loneliness it gasan timan varia there is no sensory perception se kam gasa. And metabolic disturbances kidney asan kamzor anemia asan so nera no ni to tam unless you people were and panakat guys tumshan pata ti asan misho dementia
ya check on specific age group ya specific इंडिकेशन शायद जैसे आपने कहा अभी कि डायबिटीज पेशेंट या हाइपरटेंसिव पेशेंट इन चांसेस आसान
ज्यादा पान गसस इन लेट लाइफ therefore mid life से बड़ा जरूरी स्टेज सो ये dementia frequency या prevalence से कवि काम करे by not taking care of your hypertension, taking care of diabetes, taking care of your exercise.
Okay.
And positivity in social life. positivity in professional life. Şu बड़ा ज़रूरी चीज़.
ये अक्ख कथ छ वारिया इम्पोर्टेंट अस छ येतन वुचन खास कर अगर कशीर मंज वुचो ये छ वारिया तूर ते आसान यम एल्डरली लुक छ तिम छ हमामस मंज बेहवान या कुन जाय बेहवान फिजिकल एक्टिविटी छ वारिया कम गसा यमन खतर क्या छ वनुन
बड़ तۭति suddenly in winter you will find more strokes, more Parkinson patient छ आसान ओतम ओस ठीक युथुय स्प्रिंग आव मन छुन पकान
ठीक
वारिया गसान छ या कंस छ diabetic neuropathy आसान ये गो बड़ कम ओतम ओस winter is a big risk factor for so many diseases from chest infections, asthma, COPDs, nervous system छ गसान वारिया they are not exposed to sunlight, B12 deficiency गसान, vitamin D deficiency गसान, and for physical inactivity गसान.
सो हमने एल्डरली लोगों की बात की, हमने डिमेंशिया की बात की. लेट्स टॉक अबाउट समथिंग व्हिच अफेक्ट्स यंग किड्स. हम एपिलेप्सी की बात करते हैं डॉक्टर साहब. आजकल मैं भी कुछ लोगों से मिलता हूँ जो कि मुझे सुनने को मिलता है कि सडनली ये केसेस जो हैं ये आपको ज़्यादा सुनने को मिल रहे हैं. 10 लोगों में से अगर आप किसी से बात करोगे तो कहीं ना कहीं 2 या 3 केसेस आपको मिल ही जाते हैं जहाँ खुदा न खास्ता बच्चे जो हैं दे हैव दिस. क्या लगता है आपको इसका
बच्चन
इसकी
मज
क्या
ओसै कॉमन एपिलेप्सीज आसान. जी एपिलेप्सीज हैज 2 एज ग्रुप्स इट कॉमन छ. अख छ आसान बच्चन अप टू एडोलेसेंट एंड अनदर ग्रुप इज एल्डरली ग्रुप. बच्चन मज छ बासान स्टडीज सहित ऑलरेडी छ तथ सतहस पे मगर इन एल्डरली ग्रुप एपिलेप्सीज हैव इंक्रीज अ लॉट ड्यू टू लिविंग लॉन्ग एंड हायर स्ट्रोक इंसिडेंस.
ओके
बे ट्रॉमा गसान ओल्ड एज में कंस अगर हेड इंजरी गछ या इन्फेक्शंस गसान they have more susceptible to see epileptic attacks.
ओके
This is a new thing which has come in last 10-15 years. Epilepsies or seizures in elderly group chu badiyomut.
So
बच्चन मन chu tuthui sui prevalence. Say which we would see 10, 15, 20 years. I have not come across literature where it shows it has increased.
ओके तो नहीं हुआ है.
नहीं उतना ही है
उतना ही
मगर है वो कॉमन है बहुत होते हैं.
सो कैसे एक पेरेंट आइडेंटिफाई करे व्हाट आर द
epilepsy is बड़ा easy गसान. Once it happens nobody is so visible and so dramatic that parents are terribly upset with the episode, and we have now good treatments for them, and believe me 70, 80, 90% of children with epilepsy can get well controlled and flourish in life. There are 10% children who can have issues due to development, due to cognitive differences, but overall the things are much better now except in a small group.
Let's talk about the female folk, Dr. Saab. Over the years, you have seen a lot of patients. इनको फीमेल फोक के बारे में आपकी क्या ऑब्जर्वेशन है? क्या ये केसेस बढ़ रहे हैं या कम हो रहे हैं?
देखिए female folk have similar diseases as everybody else, but they have more vulnerabilities because of periods, because of childbirth, and a lot of gender issues. And many times we have seen their symptoms are neglected for a long time.
Okay.
And it has also been observed that women as such have more autoimmune diseases because of internal inflammation. There's a lot of theories which have come up, but probably autoimmune diseases are more common in women, in addition to the gender-related diseases.
You must have also noticed कि पोस्टमार्टम डिप्रेशन भी एक बहुत इम्पोर्टेंट
Very important.
सब्जेक्ट है जिस पे बात करनी चाहिए. एंड आई थिंक इट नीड्स अ लॉट ऑफ अवेयरनेस.
Lot of evidence.
Yes.
You see, every mother who goes through a childbirth, it's a big stress.
So what do you have to say about it? What is your observation?
Should we observe how they are? Do they get good sleep after delivery? Do they eat well? Is their mood okay? Anger to nahi hai? Are they affectionate with their child? How majority do it, but there's this significant which can cause postpartum depression is very common, and probably they may have some anxieties in the past which gets more manifest after childbirth.
A lot of, maybe, I don't know if a lot of women must be watching our podcast right now. Some of them might be expecting. उनसे क्या कहना चाहते हैं, particularly about postpartum
They should be
depression?
positive about it, and if they have any symptom, immediately see a doctor who can guide them, counsel them, and may give some amount of medication also, and they are highly curable and they are self-limiting many times.
So depression की अगर मैं बात करूं, आजकल आप देखें we get to hear this word a lot. और इसके बारे में आपकी ऑब्जर्वेशन क्या है?
It's very common, as I told you, psychological disturbance of depression is is in epidemic proportions in every age group. You may have even elderly person, their depression manifests in a different way. In children, it manifests in different way. And they have varied manifestations, and sometimes they are, if they are visible, everybody will diagnose and treat them. Sometimes they are dormant, the symptoms of depression, and they present with somatic symptoms. Just memory loss,
Okay.
booh come, aches and pains, so many things they can have, and especially headaches are very common. And doctor has to be very keen observer and spend some time with the patient if he doesn't find a visible diagnosis that it may be underlying depression in him.
कहीं ना कहीं साइंस सोसाइटी मज टैबू थी रिलेटेड अगर कंस वनो अमिस डिप्रेशन सह वनान ना बह गस डॉक्टरस निश बह क्या खेम दवा ब्याह मिसकनसेप्शन कि अगर कंस ते शख्सन डिप्रेशन दवा खेव पस खेन लाइफ लॉन्ग
Doshway china pose tooth, so suppose depression is the dark sub davaka. If it is relapsing, recurrent, then only a long-term medication may be needed. Otherwise, they get well with treatment, we have very good treatment therapies now. There are a group of people, depressive, where they require treatment long term, and many times patients refuse to go to doctor. They feel a social stigma. You see, mental disorders, but the home people or parents or घर वाले वो hide करते हैं इसको. They don't want it to become visible because they seem it is socially a little not the right thing to do. And second thing is the patient himself is very reluctant. तो बस सेल्फ एस्टीम बासान गसम कर बस न ब्रेव बस न कैपेबल बस यूथ कमजोर कि बस उदास या यू आर राइट एंड इट नो इत मज other psychological disturbances are mostly hidden. You see, hidden volcano hit mental disorders are very hidden.
बिल्कुल
Very hidden,
तो
very hidden.
they need to be studied डॉक्टर साहब मतलब
And social awareness with, because they can be cured, they can be treated, they can be managed well, and they can have a flourishing life.
Absolutely. डॉक्टर साहब तुहज अख एडवाइस वुचन वालियन खतर क्या आइस related to the global audience which we have तो बेई कशरन खतर specifically
I think the 2-3 things I'll tell you. Family structure, joint family structure, it's a big insurance for health, I tell you. I say by being together is a big insurance for good health.
बिल्कुल
I'll give an example from evolution. You see, humans yod flourish. There were there were a lot of things which had come before humans, which were like human, Neanderthals. They were human, but they couldn't survive. This is because they lacked family structures. They lacked togetherness. This togetherness will keep health of children well, health of families well, health of adults well, elderly. They should, number two, have meaningful lives. Meaningful lives doesn't mean rich lives monetarily. Doing something very positive that gives good health. That's very important. And invest in your own health. We invest in homes, we invest in cars. We forget to invest in our own health. Like we don't exercise, we don't even entertain well. We erratically do all the things. I think that's very important. Being together, investing in your own health, and having a meaningful, rich life, not monetarily, otherwise.
ओके डॉक्टर साहब ये मैसेज बहुत प्यारी बट देन आप जब भी कह रहे थे ना एक जहन में मेरे सवाल आया मुझे पूछना ही पूछना है दिस इज द गैजेट इन आवर हैंड द मोबाइल फोन डू यू थिंक इट्स रिस्पॉन्सिबल फॉर major diseases which are happening, especially stress related and the time spent with family?
If you take it in a different frame, this is so useful.
It is. Why not?
Amazing. हासिब भाई इसके बगैर काम कैसे होगा? मैसेज देना है, लेटर लिखना है, बैंक से काम करना है, टिकट निकालनी है. It's so useful. But the other side of it can be a little, not little, it can affect the the life of children, of everybody.
Have you come across a patient who
So
was
many,
addicted to
there is-
mobile phones, especially
so
kids?
many, I say, there is so many at every age group. That is the menace of it.
What is your message to parents जिनके बच्चे मोबाइल फोन्स पे होते हैं?
बिल्कुल, you should use it. Mobile should not use you.
That's wonderful.
Mobile should not use you. Otherwise, you are becoming servants of this gadget, which is affecting our everything.
Absolutely. So, Dr. Saab,
Relationships, health, etc. Everything.
तुहन सटा शुक्रिया आश्चपाई तो अशु नियरुन. You are already running late. तुहन सटा
Thank you so
शुक्रिया.
much. Thank you so much. It's been wonderful to
always lovely talking to you, Dr.
Love
Saab.
to
So
you.
on that note, इंशाल्लाह डॉक्टर साहब जब अगली बार यहाँ आएंगे
जरूर,
इनकम
जरूर,
स्टूडियो में फिर दावत देंगे.
ना जरूर आएंगे.
मोबाइल फोन के बारे में डॉक्टर साहब ने कहा कि you should use it. It
Mobile
should not use you.
It should not use you. It is very useful for this. Very useful. I have seen it. I was also not. But then you should be able to be without it also.
Absolutely. So on that note, बहुत बहुत शुक्रिया देखने के लिए.